Hello, I'm Dr. Alexander Sinclair. I'm a board-certified plastic surgeon. Today we're going to be speaking about one of my favorite topics, facial feminization, commonly known as FFS surgery, facial feminization surgery. Another type of either implant or modification is something to do to the chin, because typically the masculine male face will have a square type of chin where the female face is much pointier and a heart-shaped face. One thing to do, and again this is a female skeleton so you see a pointy face, but the male skeleton will have a square shape here, and then the sides of the chin are sanded down. Or if the chin is lacking in protrusion, I can put in a very small implant. It's called a button implant. Again, this is med-por. There's another procedure called a sliding genioplasty, where a cut is made in the bone and the bone is pulled out anywhere from 4 millimeters to 8 millimeters. So you can get a lot of protrusion, and you can also, in doing so, you're going to tighten the neck and tighten the neck muscles and give a great neckline. That's one of the things that will give a more heart-shaped and pointy face, particularly in patients that have a retrusive chin, a chin that's very far back. Another area of concern is the mandible. The male skeleton is usually wider, and it's very wide at the mandibular angles. That's this area over here, corresponds to the angle. It's called the angle of the mandible because there's the ascending part, here's the horizontal part, and this sticks out. Again, this is a female one, it's relatively thin, but in a male one, sometimes it'll be as thick as your thumb. So that can be taken off. Everything here is done through the mouth. There are no external scars, and that bone will be removed. And so think of it this way. The typical male appearance would have a piece of bone sticking out like this. So that would be removed and creating a much more heart-shaped, thinner, more streamlined face. Frontal bone setback, mid-face, cheek augmentation, and chin-jaw contouring, either with removal of the mandibular angles, contouring of the chin, or an advancement of the chin. Those are three of the commonly done bony changes in facial feminization. Thank you for listening.